Free State Health MEC Monyatso Mahlatsi has announced the return of over 1,000 workers contracted during the COVID-19 pandemic. The workers' contracts were not renewed in October 2024 due to budget constraints. The reinstatement is a welcome boost to the provision of healthcare services in the Free State. And for more on this, we're now joined by Monyatso Mahlatsi, the MEC for Health in the Free State. He joins us now via our video link. MEC, thank you so much for your time this evening here on SABC News. I'm sure this is good news for the Free State healthcare sector with the bringing on board of these more than 1,000 additional workers.
Good evening to you and your viewers and the team as well. It's actually a very huge relief for us as Free State Health that we will be having almost just above 1,000 workers joining our ranks, particularly in the front line. That's going to be a very huge relief for us. We just wish we could afford to make that staff complement to be part of our permanent staff complement, but we believe that in future that will be achieved. But it's a great relief for us as well.
And MEC, I mean, these workers were let go in October. Maybe paint a picture for us and let us know how was the situation, at your healthcare facilities in November. I remember receiving a number of complaints by a number of people living in the Free State saying that, the access to healthcare has become difficult now that, some of these healthcare workers were let go.
It was really a very difficult time for us after we could not renew or extend the contract because of financial constraints. This has also led to us not being able to do basic things like capturing the data after we have seen the patients and clients across the province. There are instances where we believe that we could have reached the 95 target, but because we have not been able to capture, that has drawn us a little bit back. And we are not able to capture because we do not have enough data capturers. I'm just illustrating that as an example that all those workers who were on contract, we really needed their services, just that we could not afford to keep them anymore. We have instances where some clinics have suffered a great deal because majority of the staff that were in those clinics were coming in as part of the contract workers. We've had an outcry from a number of clinics across the province whereby even the community was calling the premier saying, but this is not sustainable. And we quite relieved that Provincial Treasury has been able to provide the much needed backup in terms of finances on this matter. It's just unfortunate that we do not have a COVID-19 grant as a permanent grant like we have with the HIV and TB and many others. If that was the case, we could then be able to appoint the staff on a permanent basis, and at least it will bring a huge relief for us.
And where did the department find the money if these were initially part of, the COVID-19 contingent? And of course, you said that there were issues around budget constraints because they were prioritized during the COVID-19 period budget. So where did the department find the money to ensure that these workers were brought back into the system?
Thank you very much for that question. Let me just illustrate that. On an annual basis, the grant that we're receiving from National Treasury has been declining. There was a time where we received 500 million. There was a time where we received 480 million. But at this point, in the current financial year, we received 262 million, and with a monthly cost of around 33 million just to pay salaries and benefits for those workers who are on contracts. So that became a little bit unsustainable for us. So we had to go back to Treasury. When I arrived in the department in July, the first ever letter that I wrote was to Treasury to say, we request 105 million to be able to cater for this cohort of workers until the end of the financial year. But unfortunately, Treasury was not able to give us the money, but we persisted, and ultimately we got 60 million from Treasury, actually 62 million, and we had about 19 million, which was a balance from our national COVID grant. We put together that amount, and it gave us a figure that where we could bring back the workers and sustain them for 3 months in a form of January, February, and March, because April is the new financial year and we will be receiving the grant from national. We sure that we'll be able to sustain them for the whole 12 months of 2025.
And what does this then mean for service delivery in the healthcare sector in the Free State?
We are so relieved in that the staff that will be coming in is going to assist us to, as I indicated, that all the staff, they are on the front line of our services. There's very few, not even 10 of the staff who are working in back offices. All of them are working in the front lines, having contact with the patients on a daily basis. I'm sure it's going to bring a lot of relief, and even the workers who are currently on the system, the burden will be released on them. Will be reduced from them, because when there is shortage of staff, then we can't even comply with the norms and standards of what the professional bodies are advising us on, because we have to prioritize patient care. So with these workers coming back into the system, that will assist us a great deal, and we believe that it will also assist in terms of reducing the stress levels amongst our members who are in the system currently.
All right, MEC, thank you so much for your time and for that elaboration. That is Free State MEC for Health, Monyatso Mahlatsi, giving us an insight there when it comes to the issues the healthcare sector was faced with. Of course, when that more than 1,000 workers were let go in, of course, October this year. But that has since now been resolved, and they will resume on the 1st of January.